Aaron, listen, I know you're busy. I know you've got up early. You've dressed nicely. It's very early in the morning, and I think you're at work already. So it's
I
fast
am.
for you. What remarks would you make about MS drugs? From what I'm seeing, and from what a lot of people are saying, it's a sliding scale. There's drugs that you should be more concerned about, and drugs you should be less concerned about.
That's exactly right. So if I make some general comments, the first comment is we don't want to do anything rash. Please, if you're watching this interview, please don't stop your medicine cold turkey in thinking that that's going to make you safe, because obviously with some of the more complex MS medicines, there's serious repercussions to stopping something cold turkey. The second comment is this is an appropriate time to reach out to your MS provider or your MS team and ask, for me, what is the best decision? Third comment is that there have been some efforts through videos like what we're doing right now, through work by my friend Gavin Giovannoni and others around the country. I've made some videos myself trying to help address this. But I do want to talk about the drugs very briefly, at least. Certain classes of drugs are simply not a concern. The injectable medicines, so interferon beta products and glutaramine acetate injections, do not suppress the white blood cell count. They are not immunosuppressants. And in my opinion, they should not be stopped, and they do not increase the risk of a worse outcome. And so if you're someone impacted by MS on a shot, my opinion is you keep on keeping on. And I would not stop the shot, and I would not be concerned about an increased risk. If I think about the pills, the various medicines of different classes that are pills, some might increase risk as compared to others. So Aubagio is a trade name for teriflunomide here in the United States. And it's my opinion that Aubagio, again, is an immunomodulator. It does not suppress the immune response. In fact, interestingly, Aubagio may have some antiviral properties that have been discussed in the literature. And at least for my patients, I am not as concerned for the patients taking teriflunomide, and I am not counseling them to come off. The other pills, quite frankly, are more confusing. There's a medicine, dimethylfumarate, so the trade name in the United States is Tecfidera. And dimethylfumarate does not suppress the immune response normally. There's about 15, maybe 20% of people that take it that have a side effect of a suppressed white count. In those patients on Tecfidera with a suppressed white count, they may be at slight increased risk of a severe infection if they contract COVID-19. And so here's a situation where if you're on that medicine, it's paramount that we know your white blood cell counts and we know the numbers, that make up those white blood cells so that we can recommend a course of action. There's a medicine, fingolimod, trade name is Gilenya here in the United States, and suppositories, which is trade named Mayzent. And these two medicines are, in my opinion, functional immunosuppressants. So they functionally suppress the peripheral immune system, and they have been associated with increased upper respiratory tract infections. Now, if you're on one of these medicines, it does not mean gloom and doom, that the world is over. I think we have to have an engaged conversation and look at other risk factors. Are you over 60? Do you have severe asthma? Are you a smoker? That combination, we might ultimately change your drug or decrease the frequency or what have you. But if you give me a 30-something on Gilenya that's doing well with no comorbid conditions, we may decide that the best course of action is to keep on with that MS medicine. Cladribine is an immunosuppressant, but the key with clad is the timing. If you had cladribine 3 years ago, there's no problem because you've pushed your immune system down and brought it back up. If you had cladribine last week, you may be in a category of risk. And this is a situation where I'm really, really enforcing stay at home. This would be someone, if they had recently had cladribine in the last year or so, who could be at risk. If we shift our attention to the infusions, the infused MS medicines, similar comments. Yeah, exactly. Natalizumab does not suppress the peripheral immune system. So if you get coughed on or sneezed on or what have you, your immune system can fight that virus or that infection the way that anyone else's could. You're not suppressed. Tysabri works by creating the Great Wall of China, blocking the immune system from the brain. And so there is a concern that if COVID-19 entered the brain of a person on Tysabri, it could be quite severe. But they have to get through the immune system first. And so not only are we not stopping Tysabri, in some cases we're switching to Tysabri as a maneuver to keep someone well controlled with their MS and yet to minimize their risk of a severe infection. It suppresses just the B cells. And yes, it is an immunosuppressant. And yes, there may be an increased risk. However, it's important to remember that you need T cells to fight viruses. And Ocrevus does not suppress T cells. It suppresses B cells. And so whereas I do think that we have to have engaged conversations, I don't think being on Ocrevus in and of itself is a gloom and doom. Lastly, one of the most effective medicines on the market is alemtuzumab or Lemtrada, and it is an immunosuppressant. And so after receiving Lemtrada, it pushes down both your B and T cells for the better part of a year. And you may find after 2 doses that you have a suppressed immune response for a period of years. And so again, it's all about timing. My patients that I treated with Lemtrada in 2017 who have reconstituted their immune system, they don't have a problem. They're actually in great shape. My patients that were dosed last year, it's a very different conversation. And right now we are holding doses of Lemtrada. We're not redosing right now because we want to leave the B cells and the T cells at their utmost. And so the take home here is that it's not a gloom and doom. It's not a stop everything. It's a call your doctor and have an engaged conversation moment.
And I just want to say before you go, everybody, Aaron's got an incredibly cool site. He does a YouTube channel with really informative videos. Obviously not quite as good as ours, but pretty close. And, if you want to like, share, everything's down there, all the usual stuff. You know how it works. You can get a hold of Aaron. You can get a hold of us. All right. Thanks a lot, everyone.
Take care. Have a great day.